Hello, my name is Sarah Ady, and I'm a cardiology pharmacist at Michigan Medicine. Today we will be discussing commonly prescribed medications for people with heart failure. Our goal today is to provide an overview of medications for heart failure and what you may expect while taking your medications. Today you will learn about the benefits of heart failure medications and how to get the most out of your medications. The types and amount of medications you take may change over time, but there are two main groups of medications for people with heart failure. Group 1 medications help your heart pump blood more efficiently, and Group 2 medications reduce your symptoms to make you feel better. You will also learn how to manage medication side effects. And finally, we will discuss medications people with heart failure need to avoid. People with heart failure will need to take some combination of medications for life. These medications help people with heart failure to live longer, reduce the need for hospital stays, and control symptoms. Your medications are key to your ability to continue living an active lifestyle and participate in your favorite activities. I want to share with you 3 tips for success that will help you get the most out of your medications. Number 1. Do not miss doses. It is very important that you take your medications as your doctor ordered. Use a calendar or a notebook to record the dates and times of the doses you take. Number 2, get refills ahead of time so you never run out and do not miss doses. Number 3, talk to your caregivers about what medications you are taking. They can help recognize any side effects you might be experiencing and prevent any drug interactions. It is also important to connect with your healthcare provider if you are not completely clear on how much and when to take your medications. This will prevent mistakes and increase the effectiveness of your medications. You should also call if you have any unusual symptoms. These may be side effects from your medication. Your doctor can adjust your dose and eliminate or reduce the severity of side effects. You should also call if you gain more than 2 pounds in a day. Your provider may need to adjust your medications. Let's talk about the different types or groups of medications to treat heart failure and what the purpose is of each group. Group 1 medications work to improve the heart's pumping function and reduce how hard the heart muscle has to work in order to pump blood. Group 2 medications help the body remove extra fluid and sodium. This reduces the severity of symptoms and helps you feel better. The first group of medications help your heart to pump blood more efficiently. When your heart is weak, your body releases stress hormones that can further damage the heart. Group 1 medications block these stress hormones from damaging the heart further. Group 1 medications include 3 categories. We will review them in the next slides. There will be many drug names listed, but you will not take all of them. Your doctor will select a combination that is specific for you. The first category are the beta blockers. Medications in this class include metoprolol, carvedilol, and bisoprolol. Common side effects with this include fatigue, dizziness, wheezing, and increased shortness of breath. You may notice more fatigue when you first start taking these medications, but it usually goes away within 2 weeks. We will review what you can do to decrease side effects later in this presentation. The second category includes 3 types of medications. Angiotensin converting enzyme inhibitors, also called ACE inhibitors, angiotensin receptor blockers, also called ARBs, and angiotensin receptor neprilysin inhibitors, also called ARNIs, are very similar. Medicines in this group include enalapril, lisinopril, ramipril, losartan, valsartan, and sacubitril/valsartan. Common side effects may include cough, only with ACE inhibitors, high potassium, worsening kidney function, dizziness, and swelling of the lips or throat. You cannot use these medications if planning a pregnancy. The third category includes aldosterone antagonists with the medications spironolactone and eplerenone. These medications may cause high potassium. Breast tenderness is a side effect only seen with spironolactone. Your doctor will prescribe medications from all three categories of Group 1 medications. They will increase the dose until you reach the amount that has been shown to offer the best benefit for your heart. For example, your team may start you on lisinopril 2.5 milligrams daily. Over several weeks, the goal is to gradually increase the dose to lisinopril 40 milligrams daily. Your provider will increase doses even if you feel well because of the long-term benefits they offer your heart. To find the right balance, your provider may need to make adjustments to your dose. They will adjust your medication doses based on your blood pressure, heart rate, lab values, and side effects. When you have heart failure, your body may hold extra fluid. This extra fluid causes symptoms such as shortness of breath and swelling in your ankles, feet, or abdomen. This is also called edema. To remove this extra fluid, your doctor may prescribe diuretics. Diuretics, also called water pills, help your body remove extra fluid by making you urinate. Diuretics do not strengthen your heart, but help improve your symptoms. Decreasing the amount of extra fluid in your body reduces shortness of breath and swelling. You may be prescribed diuretics from one or both of the following categories: loop diuretics or thiazide diuretics. Both categories may have side effects such as low potassium, muscle cramps, or dizziness. Diuretics are extremely useful to alleviate symptoms and discomfort, but you need to follow these guidelines to make them work for you. Take your diuretic at the same time each day. Do not take your diuretic before going to bed, as this may cause you to get up at night to urinate. To avoid this, try to take your diuretic before 6 p.m. If you take your diuretic twice a day, take your first dose in the morning and take the second dose 6 to 8 hours later. Do not skip your diuretic when you're away from home. If needed, adjust your dosing around your trip. You can take your diuretic earlier or wait until after you return home. Sometimes a medicine can cause unwanted effects. These are called side effects. Next, I will review some of the side effects that may be caused by your heart failure medicines and what to do if you experience them. It's important to talk to your healthcare provider if you are experiencing any of these side effects. If you have dry cough, talk to your provider about switching to another medication. If you have dizziness, monitor your blood pressure and weight daily. Change positions slowly. If you have fatigue, talk to your provider. They may need to make changes in your dose. Fatigue often goes away after your medication is adjusted. If you have shortness of breath, call your provider. This may be a medication side effect or a symptom of your heart failure. If you have high or low potassium blood levels, schedule regular checkups with your provider so they can check your blood lab values. If you have worsening kidney function, schedule regular checkups with your provider so they can check your lab values to monitor how your kidneys are working. Monitor your weight daily. If you have breast tenderness, talk to your provider. They may need to switch your medication. This is the most important of all. If you have swelling in the lips or throat, you must call 911 immediately. This may be life-threatening. There are some over-the-counter medications that may cause problems for a person with heart failure. You need to avoid taking non-steroidal anti-inflammatory drugs, also called NSAIDs. NSAIDs are common over-the-counter medicines that are used to relieve pain and reduce fever. Examples of NSAIDs include ibuprofen. Brand names of ibuprofen medicines are Advil and Motrin and a few others. Another example of an NSAID medicine you need to avoid is naproxen. Brand names are Aleve and naproxen. You need to avoid NSAID medicines because they can worsen heart failure and decrease kidney function. To relieve pain and reduce fever, you can take acetaminophen instead. A common brand name for acetaminophen is Tylenol. Aspirin is an NSAID, but you may continue to use it if your provider prescribed it previously. Other over-the-counter medicines to avoid are antacids. These medicines are high in sodium and may increase buildup of water in the body. They can decrease the effectiveness of your heart failure medications. Decongestants used for coughs and colds can increase your blood pressure or heart rate. Please discuss with your provider before taking. Be very careful with dietary or herbal supplements. A few that you may have heard of are ginkgo biloba, ginseng, echinacea, and valerian root. These drugs may interfere with the action of your heart failure medications and may have other harmful effects. Please discuss with your provider before taking. Here are some more tips to help you get the maximum benefit from your medications. Bring your list of prescription and over-the-counter medications to all appointments. This includes prescriptions, over-the-counter, and any supplements or dietary medicines you are taking. Store medications in a cool, dry place. If you miss a dose, take it as soon as possible, but skip it if it is almost time for your next dose. Never take a double dose or extra doses. Before we end, let's recap what we learned today. To treat your heart failure, you will take a combination of medications from Group 1 that work to improve the heart's pumping function and a diuretic, what we commonly call a water pill, to help the body remove extra fluid and sodium. Follow these guidelines to get the most out of your medications. Do not miss doses. Get refills ahead of time. Call your healthcare providers if you have side effects. Call 911 if you have swelling in the lips or throat. Avoid taking antacids, decongestants, and non-steroidal anti-inflammatory drugs such as ibuprofen. You can take acetaminophen, also called Tylenol. Talk with your healthcare provider about any dietary or herbal supplements you are taking. Thank you for watching our presentation. If you have more questions about heart failure medications, call your primary care doctor or contact Michigan Medicine Cardiovascular Center at 888-287-1082.